Today we're getting under the hood with Jackie Giannelli, a mother, daughter, sister, and a board-certified family nurse practitioner specializing in women's health with extensive expertise in hormonal health, menopause, women's sexual health, and urogynecology. Jackie is a Menopause Society-certified practitioner and an active member of the International Society for the Study of Women's Sexual Health. Previously, Jackie has served as the founding nurse practitioner for the director of clinical practice at Elektra Health, a digital women's health company on a mission to smash the menopause taboo. She advises and consults regularly in the digital health and startup space, and often mentors clinicians who are looking to pivot from the bedside into non-traditional clinical roles. She continues to practice bedside medicine and is the director of women's sexual health at Anna Barbieri, MD, in New York City, and a clinical strategist for the Carolyn Rowan Center for Women's Health at Mount Sinai. Jackie is passionate about women's health literacy and using technology to expand access to care, as well as innovation in clinical strategy. Jackie aims to democratize access to evidence-based wellness education using her social media platform, podcast, and newsletter, and through the creation of her signature coaching program, the Unbridled Longevity Blueprint, trademark. And Jackie earned her nursing degree at New York University and San Francisco State University and a BA in Health Studies from Georgetown University. Her work has been featured in Well and Good, Goop, Pop Sugar, and Everyday Health. She is sought after national speaker and educator in the field of women's health. Wow, welcome, Jackie.
Thank you, Elizabeth, for having me at Under the Sisterhood. This is fantastic to get to chat with you today.
Oh, I'm so excited. It's season 4, Women's March for Mental Wellness. And just being in the space you're in, you touch it in so many different ways. So if it's okay, I'd love to get going.
Let's do it.
Awesome. I love this question. I ask every woman it. What got you in and understanding the mental health and wellness space?
Yeah, it's so interesting. I am a family nurse practitioner. So what that means, for those who don't know, I'm not a gynecologist, right? I'm not a urologist. I'm this sort of generalist. And when you're trained that way, not only through family medicine, which is primary care, but also as a nurse, you really look at things a little bit differently. You're just innately going to take a more holistic, integrated, woman first approach to your care. It's kind of in our DNA. And that really is the North Star for me when I look and meet and chat with truly anyone who has a story to tell about their women's health experience, about their hormonal health, about their mental health, about their sexual health. Really, all of it is connected. Our brain, our mind, our body, if we want to get like woo woo, our soul, right? Our spirit, like they're all one. And unfortunately, our conventional medical system is set up in such a way that it really chops us up into little pieces and then diagnoses us based on systems. And none of those systems or governing sort of disciplines of medicine really speak to each other. And I think that that's become incredibly frustrating for women, particularly in midlife. We're not having babies anymore, right? We've got different prerogatives, we've got different initiatives, and we are feeling a little, marginalized in the current care system as well. And all of this, the confluence of all of this really does lead to frustration, feeling, othered in a lot of ways. And it's come to a head, I think, in the last couple of years. And so my draw to this space really stems from all of that, but truly midlife health, women's hormonal health is as much about mental health as it is about your, what we call bikini medicine, right? Which is like breasts, uterus, ovaries. Like we're so much more than that. And our brain is a massive end organ receiver of our hormones. So I became super interested in how hormones behave in our brain and how they influence our behavior through my work.
It's wonderful. Well, that's a really, I just, I'm like sitting here, I'm pausing for a second, which is unusual. But I think that's amazing, Jackie. I think that there's a lot to unpack here. And I think first and foremost, being a family practice, coming at it from a family perspective, looking at people holistically, and then more specifically women. I'd love to get into that and dive into that. So was that like coming out of college? You went into what was your experience like that took you on that journey?
It was nonlinear for sure. And I think that that's the beauty of it. And I kind of chose that on purpose. I was pre-med. I was at Georgetown and I knew I loved the human body and human science. And I even knew loved neuroscience, to be perfectly honest with you. I was looking around and I really loved the neuroscience program at NYU. And I thought about that for a minute. I love nutrition. I love behavioral health and like the sociology of that. Like all of those little areas were interesting to me. And so when I was applying to medical school and thinking hard about did I want to be a doctor? What did I want? I don't know how I had this foresight, to be perfectly honest with you. I was, what was I, 22 or 21? I just thought I didn't want to be pigeonholed into one particular subspecialty of medicine. Like I really loved pediatrics and I knew, if I was a pediatrician, that would really, stick me in that box. You really can't pivot very well. At least I didn't think so at the time from being what would be a pediatrician. Like actually another nurse gave me incredible advice. And she said, Jackie, don't go be, when I was going back to nursing school, she's like, don't be a pediatric nurse practitioner or pediatrician. She's like, be a generalist. She's like, be a family nurse practitioner. It will allow you to do anything you want to do. And I really am grateful to that person for telling me that because it allowed me then to pivot from being what I was. So long story short, I went back to nursing school at NYU after a very short stint in public relations, knowing that I loved communications and writing and speaking and educating. And about 6 months into PR, I was like, oh boy, this field is not for me. I'm like the wrong person for this. I'll come back to it someday, and maybe I have in some ways. But then, nursing school, really loving peds. I was a peds cardiac ICU nurse. I took care of babies with major heart defects. I moved to California, met some of my best friends working, at Stanford at the time, and just loved the challenge of the ICU and the autonomy and the critical thinking. So that's always been something I've sought out no matter where you go. I think it's really important when you're thinking about your career to really think about not just like where you want to work or what discipline, but what your skills are and where you can apply them in different places. I think that's like even more important to think about now.
What's particularly interesting to me as well is now that you focus more on midlife, it's sort of in a way growing up with you. And having spoken with a lot of OBGYNs who have like literally grown with their patients, they're aging and growing and evolving with their patients. It sounds kind of familiar because I'm kind of curious, like what took you? So you went in, you did this family broadly, and it would be great to understanding how your practice and has unfolded over your career.
Yeah, thank you for saying that. That's actually the first time I've heard it said that way, that it was growing with me. I think about that for gynecologists, yes, but yeah, you're right about that. So for me, how did I end up pivoting into women's health? It was kind of by accident, but kind of not. I mean, when you're in peds, you're taking care of the whole family, and I sat at bedsides with many a mother of a child, who was going through a hard time, and so you learn to take care of everybody who's in your, in your proximity. And so I had just become an NP. We just moved back to the East Coast. And I was kind of I had an open mind about what I was going to do. And there was just opportunity, honestly, to be in urology. And I don't know, somehow I've always found this like path less traveled. There aren't a lot of women in urology. It's kind of a male dominated field if you think about what a classic urologist is. And so I actually took care of men, I took care of women, I took care of, patients with prostate cancer, gynecologic cancer in more of an inpatient setting, and just kept stepping back from that as I'd had my own kids and realizing, like I didn't really want to be working in a hospital anymore, moving through all of that, and just kept asking good questions about the things that weren't being done well in the environments that I was practicing in. So in urology, I just kept seeing woman after woman come in with recurrent UTIs, pain with sex, even just complaining of menopause symptoms, which, back in, 2015, you kind of weren't even connecting the dots. At least most of us weren't. And just getting curious about what I kept seeing on repeat and why. I then really got interested in hormones and women's health and women's sexual health in particular, pain with sex, desires of arousal and orgasm and libido. And it just we were just dropping the ball left and right. Like this was like not being done well at all. And I was just fortunate to be able to be in close proximity to one of the largest, biggest women's sexual health centers in the country at the time, and reached out to them. And I was like, I want to do this. I want to learn this. Hire me. And they did. And I was mentored by another nurse practitioner who had been part of the formation of this center. And that is truly, I'm grateful for that because she taught me pretty much everything I needed to know. and kept being curious. And really, there is where, to the mental health conversation, that's where I really saw how much of women's health is related to mental health. You cannot treat women's sexual health and hormonal health or menopause and not understand the impact on someone's serotonin, their brain, the way that their hormones influence, their choices every day. It's so fascinating to me, and that was the turning point.
I love the fact that you followed your curiosity, but also are addressing real critical gaps. And I'm just in awe of the way you're able to communicate and articulate very complex issues and distill it down for women to understand and really speak about it. But as I'm thinking about getting back to the whole mental health side of it, women's health is mental health. It's all interconnected. I've been interestingly talking with a lot of women, particularly in the perimenopause phase as well, and they're just realizing that now more than anything, mental health is a huge issue as it relates to that phase of the life. So in a way, not to put you on the spot, which you're on the spot, is to go in a little more deeper from your understanding from a hormonal perspective during this transition phase of life, the correlation and the connection between mental health and midlife transition would be really wonderful to share with the audience.
Yeah, it's such an under discussed aspect of menopause and such a large part of the symptomatic experience that a woman has. And it is one of the first things that impacts women in the beginning of perimenopause, which, so for those who don't know, are the years, the 5 to 10 years potentially leading up to the final menstrual period is considered perimenopause. And it is the time truly where women feel most not like themselves, and where they go to their gynecologist or go to some, start thinking a little bit more like, what's happening here? Is there something wrong with me? And they go ask for help. And oftentimes they're, experiencing gaslighting, or sorry, come back when you don't have your period anymore, or gosh, have a glass of wine and, it'll take a vacation and it'll get better. Like, these are truly things that are still being said in 2025. So we need to do better. But with that said, yes, the brain, as I mentioned, is one of the largest receivers of your hormones. And it's these clues about how your brain receives hormones, estrogen, progesterone, testosterone, cortisol, melatonin, I could go on, happen way before midlife. So this is something, that you start, this is why your teenage daughter, at 12 or whatever is starting to act a little different, because estrogen is starting to come into her brain in a new and different way and in abundance. And that is shaping her brain. So are the androgens, the testosterone, also an important female hormone that we don't talk enough about, starting to enter her systemic circulation, and anything that crosses this blood-brain barrier is going to get into your brain and shape your neural connections, which shape your behavior. So I'm fascinated by the way that happens over time. Women's brains are constantly awash in hormones and in fluctuating hormones. And that actually lends itself to neuroplasticity, meaning that the neurons learn to accommodate different hormonal milieus and different hormonal states. And that's what makes women, honestly, so amazing and have such superpowers and be able to tolerate pain so much better than their male counterparts, right? Be able to tolerate traumatic experiences and have that fortitude to move through life. Our cycles give us that gift, which is incredible. And so, when we talk about puberty, we also need to talk about postpartum. That's another huge hormonal transition. You're going from really high levels of hormones to really low levels of hormones after your baby is born. And that too really, impacts women's brains, tremendously. And that's why women do feel like, gosh, this doesn't feel like me. I'm crying all the time. I have no resilience. What's happening here? And we don't teach women about this. And so there is this feeling of like, it's just me or I'm broken. And then that persists through midlife. In fact, you could even look to your regular cycles and say, how have I historically felt in my 20s, 30s, and 40s, those 2 to 3 days before my period begins? And that will give you clues. I think it's important for women to do this as an exercise to what your midlife mental health experience might look like. Not everyone experiences anxiety, depression in midlife. There are plenty of women who don't, but many, many women do. And oftentimes these things correlate. And truly, it is the impact of estrogen on serotonin, norepinephrine too, via the same pathway, testosterone on your dopamine, progesterone on your GABA receptors. These are all neuromodulators, and these impact the confluence and how they all play together in your brain really dictates how you feel.
What's fascinating to me about the whole thing is, first of all, the fact that we don't understand it, that we're just now talking about it. You made the comment that in 2015, this is like, you didn't use the word taboo, but it was kind of taboo. We never talked about it. Like, I know, I had a spontaneous autoimmune disease happen during perimenopause. I didn't even know it was perimenopause back then. And so I'm in remission from it. I heard another story. And sorry for the segue. It's like not the perfect segue, but I think it's a good segue. I heard another story from a woman who had, I think, her second child or third child in, I want to say her late 30s. Back then, no idea that she would have been going through perimenopause. You made the comment about postpartum as another inflection point where you're having all those different hormonal changes. She went through severe depression for like 10 years, like in a dark place for 10 years. It turned out that postpartum was colliding or converging with perimenopause. And I'd love for you to talk a little bit about that.
This is an issue too, and I have lots of, friends who are having babies later in life. We are, doing that societally now, with IVF, and we're, afforded this opportunity to, give birth in your 40s if, you so desire. And that's amazing. And that's great. But what we're failing at doing is really understanding, and honestly, they're kind of the same, what is perimenopause and what is postpartum? And the truth is that they are overlapping. And they're very similar as well. It's really most of the symptoms you're feeling postpartum, if you understand what is happening in your body, your hormones are crashing, right? Postpartum, or they're low. And we're able to recover from that, I think, with a little more resilience when our brains are younger. Like, this is just chronologic aging, right? This is a fact. We're all aging humans. So we do have to accept that there's a little less resilience built in. And we can work with that. But what I think happens is everyone, is like, this could be perimenopause. And they're like, no, it's postpartum. Or everyone's very focused on the reproductive state. And so sometimes they do miss that there are overlaps, that these two things are not siloed experiences, right? You don't just go from like being fertile to being infertile, that these two things are segueing across each other. And the way that it is treated is truly through the same modalities, right? We can give hormone therapy to postpartum women, even postpartum women who are in their 20s and 30s. Like, we can use the same bioidentical hormones, progesterone in particular, or estradiol if needed, to curate the mental health and wellness of women across those two life stages. And I think that women are often looking for someone to tell them, like, it's this or it's that. And the truth is that it's probably both. And that's okay, because it doesn't matter, that we're going to treat you the same way regardless. And so there's some solace in that, I think.
That's very helpful. And I appreciate the ability to treat it sort of the same way. I think that's interesting. Jackie, I'm kind of curious. I mean, you have so much experience, and I think we should tap in first to sexual health, which you seem to really enjoy and talk about enthusiastically. I'd love to get your thoughts on that in terms of, based on both what you're doing and celebrate the work you're doing, and also as you look to mental health as the overlay, if you will.
Yeah, women's sexual health is I don't know, I call it like a niche within a niche. It's a field of medicine that actually is never taught. I mean, menopause is not taught, but women's sexual health is really not taught. Luckily, there are a passionate group of individuals at a society called the International Society for the Study of Women's Sexual Health, which is a long name. ISWISH is what you may hear it acronized to. Acronym. I can't even say that word as an acronym. And they are truly the best providers in the world, because they are critical thinkers, flexible thinkers, have been willing to go outside of the box for women to really help them through what is a very common experience for women, which is loss of libido, loss of desire, especially in midlife, but throughout the life. And so much of that is what we call biopsychosocial, meaning that it is not in your head and it is not just a physical problem, that we cannot truly fundamentally tease those things apart, because your physical experience will impact your mental health. And one example I give of this usually is sexual pain. Women experience sexual pain for a lot of reasons. It's not just trauma related, right? It can be because of hormonal changes. It can be because of pelvic floor dysfunction. It can be because of nerve pain. Like, there's a lot of reasons women experience pain with sex. And when you do experience pain that is untreated, and you keep having the same painful experience over and over again, your brain gets involved, right? And the chronic pain and the trauma response starts to turn on. And oftentimes our body goes into this like either fight or flight or protective mode. And so we start anticipating pain, and then that causes a physical response where our pelvic floor sometimes clenches. And then when the pelvic floor clenches, that causes more pain, which so you could see how it like compounds on itself in this way. And so when we think about treating someone who's had long-standing sexual pain that that has evolved this way, we actually need to treat it both with a like through a mental health and therapeutic lens of your anxiety, your depression around that. Like we cannot treat the physical and not expect the mental health to also like for us to bring up stuff around that. And we work closely with therapists for this exact reason, because if I'm treating someone's long-standing pain, they're going to have some feelings about that as we move through it.
Well, actually, to that point, I'm kind of curious. Could there be mental health issues around it before it even happens, the physical side of it, going into, any sort of sexual experience without the right mental state? You know what I
Yes.
mean? Could that as well be contribute to the pain? So versus
100%.
versus, I'm thinking, what came first, the chicken or the egg in this case? And I think with
Yes.
women, we have so much on our plate, right? I mean, we're taking care of families, we have jobs, we're doing all the things to keep everything in our worlds and in our community standing and strong. And we're often not taking care of ourselves. And we can go into those situations because you kind of have to be ready, right?
You do. And it starts young, when we don't talk to our kids about what their hormones do, what their bodies are, we name the body parts the way they're supposed to, when we shroud all of this in shame and taboo. And, you think about like having like the birds and the bees talk, with your kids. And it became this like, thing we had to sit down and do, and you were pulled aside, and just that act, the act of talking to someone that way, like tells, even if you're not saying it, you're telling someone that this is something we like, we're really like gonna have to talk about carefully, and don't tell your friends. And like it starts so young, where the messages around sex are just given and such delivered in such a shameful way, even if we don't mean to. And so I really, I try to talk about this stuff casually. And my kids, obviously, I'm at home, they hear me on podcasts, they see books around the house. Like this is not something that, I am shy to talk about. And so I think that, when we start from a place of just openness and curiosity again, I think that that's helpful. I think we need to, it's sad in this country, but we don't do a great job of educating anyone about sex, what's normal, what's not normal. The movies on TV, show a certain kind of sex that is not at all, what real sex is like for people. We're telling women to be sexy, but we don't want them to be sexual, right? And that's very
Ooh.
confusing for people, right? You're not allowed to like have a sexual
Mm.
desire, but you must, be beautiful and portray sexiness. And like, what kind of messaging is that? Like, that's not fair, And so it takes some confidence for people to be like, I don't care what people think about me or the world thinks about me. I'm just going to own this conversation. Like, we're muting that for a lot of women. And, society is not, we can't even talk like, we can't talk on Instagram about this without getting banned. So it's becoming harder and harder. But I think through really good at hormonal health education, and if you understand why your body's behaving, like even if that's not the end solution, it's a starting place. It's truly a place of, okay, this is not just me. There's a physiologic reason here, and I can then move from an educated place, which is so much better than moving from a place of fear or ignorance.
Yeah, and I want to build on that. First of all, thank you for that. I think that was just, I mean, there's so much content and richness in what you just shared. I think on one hand, I think a lot about, you said if we could only start earlier and feel comfortable having those conversations. I mean, Jackie, I have two adult women, daughters who are amazing. And I have to say, when it was having the conversation, while I'm a very open person, it was really hard because I never had the right. I had a very kind of unusual conversation with my mom and stuff. So it wasn't like necessarily natural. It wasn't shameful or anything, but it's really interesting to see them. And I'm only sharing this because now as adult women, in their early 30s, I'm looking at them and they're very comfortable having the conversations. And now we talk about it all the time and different things and all the things you feel and stuff. So I think it's amazing. But I think back to censorship, and
Mhm.
I love the analogy that you made, which is women are supposed to look sexy but not be sexual. And I think that that's a very confusing message to put out there. And I think back to also the comment around censorship, the fact that we're being censored. So how do we begin to have the conversations? That said, I think what's very interesting about this time and the next generations is conversations are finally being had. So it's like the Pandora's box has been open and we are talking and, we're talking in different ways. We're learning. And it's people like you as educators and experts in this space who give permission to that and take away, you don't realize the power in just having this conversation and sharing this way that you're opening other women up to have the conversation because you're destigmatizing it. And so I'm kind of curious about, so we talked a little bit about kind of each stage, like what are you seeing in the postmenopausal?
Fun stuff, actually. I think the hardest time, I mean, listen, like we could go on and on about like the way that the internet is changing the way younger kids are thinking about dating and sex and, the discomfort that they feel in initiating any kind of social interaction, let alone a sexual one. And there was a really great article in the New York Times a couple of months ago about Gen X women having the best sex. And it is because they are right at this age where they kind of don't care anymore, but also they're last generation to grow up without an iPhone or some sort of like phone or internet, like, getting in the way of their social interactions. And now they're to this age where they're through the hard part of perimenopause, right? They're now postmenopausal. Maybe they're on hormone therapy, maybe they're not. But either way, you have a static level of hormones, right? Your hormones are no longer bouncing around. Like I always give the analogy of like taking a bouncy ball at the top of a hill in San Francisco and like throwing the ball down the hill and like watching it do that. Like that's chaos. And so we definitely, have that gift after menopause of like no more periods, no more crazy hormone fluctuations, truly just this like this safe, stable place from which we can operate from. And so that's sometimes when women are like taking a look in the mirror again after all of that happened and saying, okay, this is the rest of my life. What do I really want? Sometimes this culminates in divorce. Sometimes this culminates in, like taking a trip to Europe with your girlfriends. It's like eat, pray, love story here. And you can see why. Maybe they're going to talk about menopause in that book, but maybe they should have. And then truly just saying like, how do I want to rethink the next, half of a quarter or third or whatever it is of my life? And what I love seeing, and I'm seeing more of it lately, and part of it is because of this conversation, are some women are feeling a little bit, I don't know, like a little bit of FOMO or a little bit of like, wait a minute, all these younger girls are getting these hormones. I want some too. And so they are coming in and asking particularly for testosterone because they want to improve their sexual health. They want to improve, their orgasms. They want to have one of the pillars of our wellness back in their life, which is their sexual vitality. And interestingly, this happens endogenously to women, meaning that we see in the data and the research that women who hit, I don't know, maybe it's around 70, 75, they get a little endogenous bump of testosterone that not a huge bump, but it kind of pops up later in life. And perhaps this is why, the retirement communities are such hotbeds.
For
Because,
UTI.
yes, people are like, I don't care. Let's have a good time, everybody. And they are just throwing caution to the wind. And we are all, men still have their testosterone. Maybe it's not as good, or many men are using testosterone replacement therapy or ED drugs, right? We hand those out like candy. And so women are like, okay, well, I'm going to use this little bump of testosterone I have, and I'm going to enjoy myself. And I love that. I love it when I see a woman who is like, comes to see me and is with like unabashedly asking those questions. There's almost no shame or stigma at that point, and it's such a fun patient to treat because often these are women who maybe have never used a vibrator, or they want to try all the fun, non-hormonal drugs or the toys or the lubes, and like they are all ears, they're all eyes, they are truly, curious and are optimizing for their happiness and their joy rather than starting from a place of feeling anxious. I'm anxious, I'm depressed. Like that's perimenopause, right? That's a whole different bag. That's a whole different treatment plan. But moving from, I feel fine. How could I feel better? Like that's the fun stuff. And I love seeing those patients.
I'm kind of curious as well about the brain fog. Like when you go through the perimenopause, you have all of that. What do you see in terms of that and the correlation with mental health with the brain fog?
Brain fog is brutal. It really starts early. It's one of the earliest perimenopausal kind of symptoms. And that is because there's many reasons for brain fog. Unfortunately, a lot of sleep. Sleep is huge, huge for so much of our wellness and our mental wellness. And when we're not sleeping, our brains just aren't firing on all cylinders. And I don't need to tell any of your listeners that. Anyone who's not sleeping gets that for any reason, right? You're just not finding your words, your thoughts aren't as crystal clear, you're not able to like be super hyper like focused on any of your work, and it impacts women at work for sure. It impacts the way you're able to just what you're able to get done in a day, and midlife women have a lot of stuff to get done in the middle of the day. So there's all of that. Certainly estradiol, the decrease in estradiol. Estradiol really helps with glucose metabolism in your brain, and your brain needs glucose in order to process thoughts and to work. And so just the same way that estrogen impacts our insulin and our body composition, estrogen also impacts the way our brains are functioning. And so giving hormone therapy has not been shown explicitly to be the only solution for brain fog. Like I can't say to somebody with brain fog, I'm going to give you hormone therapy and you're going to be, firing like, you're going to be thinking as good as you were when you were 25. Partly it's because of this kind of multifactorial hormonal fluctuation happening. So testosterone, androgens actually are very impactful for the brain. And that's because testosterone really improves dopamine. Dopamine is that neuromodulator that's like get excited, feel really crisp, get like in the moment, like be ready to attack. And that is what shapes some of our cognitive clarity and our motivation and our confidence. And so much of that's happening in our brain, right? So brain fog sometimes is an androgen problem. So it could be a lot of things. And that's where working with a practitioner who gets this stuff, who knows how to curate, I guess, a bespoke hormonal plan for you that truly hits on all of those boxes. Your brain fog is one of the hardest symptoms of perimenopause to get right. There's not a crystal clear answer, but that's the science.
Do you see that at postmenopausal phases, the brain fog sort of comes down again?
Yes. Yes, you definitely do see that. Although, if it's related to loss of testosterone and somebody's not replacing their testosterone in some way, or if it's related to metabolic dysfunction, for example, like insulin problems or changes in just general inflammation, cortisol can impact your brain. Your brain hates inflammation. Cortisol in excess is actually really bad for our brain. And that is because it's actually been shown to sort of like temporarily shrink the brain. Yeah, so cortisol for sure is terrible for our brain. It actually contributes to inflammation when it's secreted in excess. And cortisol is our chronic stress hormone. Everybody knows what cortisol is these days. It's trending online, unfortunately. And people are looking for solutions to really manage stress for the multitude of impacts it has on our brain and our body and our sense of well-being. So brain fog, I would say, is one of the hardest things to nail. Like I said, hormone therapy can be helpful, but it often requires us to think a little harder about our nervous system and look a little harder sometimes at what's going on in our life and really be honest with ourselves about where we can trim the fat and like what can be tolerated as a part of our life and what we need to edit.
Jackie, on a personal and professional note, how would you say you're marching for mental wellness?
I'm trying really hard, Elizabeth, to march for mental wellness. I just truly think that one of the things that our healthcare system gets wrong is that we're starting from this place of like, I'm the provider, you're the receiver of my information, and you will just do what I say, without question. And I don't think women are up for that game anymore. I actually think that women of all ages really want to be active participants in their care. And this is what differentiates men from women in the healthcare system. I think a lot of men just want to be told what to do. And, they're very happy to just be handed a prescription and they will actually just follow through. And it's what makes them actually a very different healthcare consumer. But women are not that way. Women are wanting to understand. They have a deep, deep desire to understand their own body and to be in charge of it. And that authoritative, I'm not, I want to learn from you, but I also want to digest it on my own terms and integrate what that looks like in my regular life is something that is incongruent, in my opinion, with our conventional healthcare system. So for me, I'm working really hard to rethink how care is delivered to women in midlife. I've been part of, a lot of innovative healthcare startups. I've thought really deeply about how women deserve to have their healthcare provided to them, thinking hard about, what women do really want, like what's going to bring them in the door, and, what then gets their trust, and how we can meet them where they are, and then continue to be a partner with them, but allow them to live their life. Like, I don't want anyone to feel reliant on me. Like, that's not the point of healthcare. The point of healthcare is to help you optimize for your quality of life. Only you know what that looks like. So I'm really working creatively on coaching programs, on my newsletter, to really reimagine what the midlife healthcare experience looks like. And one thing I know wholeheartedly is that it starts with education and empowerment. And the prescription writing is truly like the last part of this process. And when we think about this differently, we can get creative with our solutioning, with our conversations, with our storytelling, like we're doing here today. And so, yeah, I think there's still to come, but that's how I'm showing up in the world these days.
Well, you're showing up in a big way, and your education and creating awareness around this is it's amazing. It's detailed, it's compassionate, and with care. What is Jackie doing for Jackie there?
Great question. And I need to be drinking my own Kool-Aid here. So it's funny. I recently got into like Enneagram testing because a friend of mine was like, you need to do this. And I was like, okay. So I'm a 3. And for those of you who've done this before, you know it basically means you thrive on achievement. And so anyone who's listened to this podcast today will understand how that plays out in my life and where I've been in my career. And so I can sometimes over-rotate on that, right? Where I'm like, achievement above all else, achievement above my rest and relaxation, above my, my own mental well-being. And I'm pretty resilient, and I'm pretty, I love what I do. And there's such a need. Like, every day someone is coming to me with questions, or, and so I'm not going to turn my back on people, but I do need to be working on boundaries, right? I need to be working on taking time to walk outside and have a walk. Next week, I'm, going to the beach with my family, which is for me a place that I always feel restored. There's like 2 places I always get restoration. One is on an airplane, because there's like no phones and no one talking to you. And you sometimes just can be like truly thinking. And some of my best work has come to me when my brain is on a different wavelength, right? And then the water. Like, I love being by the water. I love the ocean. I've grown up by the beach, sitting, on a beach with water on your feet, or just, going into a cold ocean. Like, there's just nothing better for you. And rest, sleeping. I love sleep. If I could do one thing, above all else, it would be sleep. So, and I feel like a different human when I've slept and not slept. So those are I just go back to the core fundamental principles of what I know historically has renewed and restored me. And where I need to do better is just drawing those lines in the sand, quote unquote.
Yes, get to the beach, run to the beach. And I love the water as well. It's very restorative. And it's interesting. I want to say another thing, just an observation I've made across the board, which is, I don't know how old your children are, but when you're a working mom and you have multiple children and you're doing it all, you're in such a state of doing. You're not in the state of being. And usually the state of being comes kind of when the kids are older, you're post-menopause, or you don't have children and you're post-menopause, and you have this transition phase where you recognize that everything isn't just about the achievement, because I was there as well, and it's about the other side of things. So I think that, it's a wonderful thing to share with women in general, which is really the need to care for ourselves because we're so busy caring for others. This has been just an incredible conversation. This is your platform today, Jack, to give women a message of all ages, of all backgrounds, of all cultures. What do you want to leave them with? I think that women there's so much AI in the world right now. We're entering a really wild time of information overload. The menopause space has tons of information. You could go down any rabbit hole you want these days. And it's about to get even crazier, with AI. And I think we
need to remember that we have an internal compass, and our bodies are truly tuned to our own rhythms, to our own. No one will know you better than you know yourself. And we are taught to maybe question that or gaslight that. I know I've questioned myself in ways that I think back on, and I'm like, no, that little voice in me when I was, 22 years old and graduating college and knew that I wanted to be in public relations, right? Why? Well, that's because I knew that there was this thing in me that needed to communicate. And so here I am again, right? And so at the time I was like, oh, this was a bad decision. Like I shouldn't have gone into PR. What was I thinking? And now I'm like, no, actually I knew what I was doing. And I want to tell everyone that they truly should not, like that internal little voice is there for a reason. Listen to it. It will guide you through midlife. It will guide you through challenging times. And women, I think, are gifted with it in a way that, intimidates some people, but it's there for you. You just have to listen.
Most women have said, it's all about like listening to your gut, your intuition. So I like the addition of the internal compass leading you because you do know. And it's interesting that you commented, Jackie, because you wouldn't have known at 21 that going in or 22 going into PR, but only in hindsight, how many of years later, there's a reason all this happened this way. And I'm able to show up, and you're an excellent communicator. So I just want to say thank you so much for getting under the hood with me today, for sharing your incredible experience with women in our community and outside.
Thank you for hosting this wonderful podcast and giving space for women's stories in mental health. It's so important that we're just, free to chat this way. And thank you for being an incredible host.
Thank you. Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.